Hi, my name is Brittany Williams. I'm a nurse practitioner student at the University of Nevada, Las Vegas, and also currently a registered nurse. And this is a discussion on the family systems theory. Okay, so today we're going to be talking about the key concepts and definitions of family systems theory. Then we'll be able to apply the information into how the theory can be utilized in family nursing practice and research. Okay, so without further ado, let's jump into the key concepts of family systems theory. Dr. Murray Bowen was a psychiatrist who was the original theorist, and he argues that families are their own system that is both interactive and interdependent. Each family member has a role that contributes to the balance of the system overall. So therefore, if a change in one person's functioning predictably causes a change in the functioning of the other family members. What affects one family member affects all parts of the family unit. Now, additionally, each family has their own culture. In other words, they have routines, rituals, traditions, and beliefs that are unique to them and them alone. And part of protecting the health of the family unit is having boundaries and barriers that control the inflow and outflow of information and people that protect both individuals and the family unit as a whole. Okay, so if you remember from the last slide, we talked about what affects one member of the family affects every part of the family unit as a whole. So Dr. Bowen likes to use a triangle as a symbol to illustrate this concept. We're going to talk about, in a basic sense, a nuclear family, and the triangle you see on the screen, the left side will represent the father, the right side will represent the mother, and the bottom side of the triangle will represent the child. You can see that the triangle is symmetrical, which means that it's balanced and that the family is existing in a healthy emotional state. However, I'm going to give you an example of a stressor being introduced into the lives of this family and how the triangle will change to accommodate this stress. So the example I'm going to give is the father unexpectedly loses his job. He's been working for a company for many years and is suddenly laid off. So this is going to throw the balance of the family way off, right? So what we're going to see is that the father is no longer bringing income into the family, and he's maybe feeling a little bit diminished and maybe even depressed. So his role as a father, you'll see his side of the triangle start to shrink. Now the rest of the triangle is going to have to change in order to accommodate this change, meaning that the other members of the family are going to have to adjust. What you might typically see in this scenario is the mother taking on a second job in order to temporarily accommodate for the loss of income of her husband. So by taking on this extra role, as the father's side begins to shrink, the mother's side will grow, and in order to keep those connections of the corner intact as one family. Now the child in this example, maybe he's middle school age, old enough to take on a little added responsibility in order to help his parents going through this stressful time. He's going to do some more household chores than he normally does. He's going to be responsible for doing the dishes, doing the laundry, things like that. That's just going to help support his parents during this time. So the child's taking on more responsibility and the mother's taking on more responsibility as the father is temporarily just going through a hard time. And that's going to cause a shift in the symmetrical balance of the triangle, because what affects one member of the family, remember, affects each member in the end. So that's why when you're looking at a symmetrical triangle, each family member's role is performing as they should, and when we're looking at an asymmetrical triangle, it means that some sort of stress has been introduced into the system, and each family member is altering their roles in order to accommodate this change. Okay, so let's jump into some definitions that are essential to understanding the way family systems theory works. We've already discussed family on previous slides. Safe to say we understand by this point that it's an interdependent unit. So let's jump right into emotional and physical health. Emotional health, like we touched on the last slide, is a balanced triangle. Emotional health is when the family is functioning peacefully without any external threats to the system. Physical health, on the other hand, this could contribute positively or negatively towards the emotional health of the family. Physical health is necessary for each family member to exist in their current roles in order to help maintain healthy balance of the system. Poor physical health of one member can offset the balance of that triangle and lead to imbalance within the family system. Environment. Now let's talk about environment, which can be therapeutic or destructive to the family unit. Each family has boundaries, whether we're talking physical or abstract boundaries, and they filter information, stressors, and people that they allow into the system. This is a self-defense mechanism that keeps the family bond close, and the permeability of each family is unique to themselves. Now, nursing, where do we come into the picture? Well, the goal of nursing is to help nurture and restore stability of the family. In other words, we're trying to restore a symmetrical triangle for this family. Emphasis should be on the family unit as a whole rather than treating individuals. Okay, now that we've had a chance to discuss what family systems theory is, we can really delve into how it applies to nursing. The truth is that family systems theory provides nurses with a framework and organized analysis of relationships that helps us to better understand therapeutic approaches to communication. Something I bet we've all seen in practice is that one method of communication with your one family does not translate to the next. Each family is unique, as we talked about in previous slides, and they all have their own subculture. So family systems theory helps us analyze that family and that culture, and we can adjust our interventions in a best way to be therapeutic for the family. This can be utilized during family therapy sessions and family meetings, because remember, at the end of the day, our goal as nurses is to help restore natural balance to the family, help make that triangle nice and symmetrical again. And if we as nurses can help a family find that healthy functioning, then we've done our job. Okay, so how can family systems theory be utilized in research? Today I'm going to give you two examples of research projects that utilize the family systems theory as their theoretical framework. This first one was from the Clinical Rehabilitation Journal that published this randomized controlled trial in 2003. The stroke patients and their families were the target population for this study, and the intervention was that these patients received stroke education and 3 visits from a social worker that's trained in family therapy. Their families were included in all the intervention. So the results were that after 6 months, the patients and their spouses of these families showed that they have better family functioning than the control group. They were more likely to, the stroke patients were more likely to help their spouse with household responsibilities, and they were more likely to engage in social activities outside of the home as well. In other words, the families that received family-based intervention showed that they were thriving, that their triangles were much more balanced, and they had a healthy emotional system as compared to the control group. The second research project that we're going to talk about today targeted advanced cancer patients in hopes that they can improve their nutritional status through family-centered interventions. This is a small pilot study that was done in 2018, and what happened was they gave family members who were living with these advanced cancer patients a role in making sure that they took their nutritional supplements every day. They were responsible for making sure that the patients had their nutritional supplements. So in doing so, the results of the study show that cancer patients reported increased energy levels and increased protein intake. And in addition to that, they had improved nutritional status. So overall, the pilot study was considered to be a success, and the testers are hoping to use this as feasibility for a more large-scale study. What I theorize happened here is that the family members were given a role and a responsibility that helped them feel empowered to help their family member during a time of need. I found that in my time as an ICU nurse that sometimes if family members are given a small task, whether it's to massage their shoulders or help brush their hair, help them eat lunch, for example, that family members go from feeling kind of helpless to feeling empowered. And so sometimes by giving family members just a sense of empowerment, we can strengthen the family's resolve as a whole. Okay, so in conclusion, the takeaways that I want you to remember from this presentation is that family systems theory can improve the life of our patients and their families through family-based interventions. Families are an interdependent system where physical and emotional well-being of each individual affects the family as a whole. Now, as nurse practitioners, what we can do is, by understanding the interworkings of a patient's family, that we can set realistic and specific goals for treatment. Now, moving forward in the semester, as we do our family assessment assignment, I will be able to use family systems theory because I'll be able to talk about how major life events have altered the family's triangulation and their functioning as a whole, and how they are reestablishing balance within the family after a major life event of losing their grandmother. That's it for today. I really appreciate you taking the time to listen to my presentation on family systems theory, and if you have any additional comments, questions, please feel free to send me a message. I appreciate any feedback. Thank you.